actually from Louisiana, and since we are all attending APA, first off, I would like to thank you so much for sharing your story, your activism, and your son with us. It's an honor to learn from this, and I hope we do right by him. My question kind of was posed to the audience. Is anyone satisfied here from their state background with involuntary holds and the policy that you have in place from your respective location? So I know in Louisiana, our system is different. Our assistant coroner tends to be a psychiatrist. Relatives can go to the coroner and request for protective custody, and then that escalates so that a patient can be escorted to emergency services and be evaluated from there. It's by no means a perfect system. And CIT is also enacted in Louisiana. However, I'm just kind of curious to hear from others if there are any effective means of involuntary holds that have been working for you to mitigate risk.
My experience is it's very variable depending on who's doing the evaluation. Like some clinicians and mobile response teams are very good, others are not so great, and the quality is very variable, unfortunately. I think probably the best thing to do is just get better training for all clinicians who are, conducting these evaluations so that they know how to respond to patients in acute crisis in the field. And even in jails, sometimes in our crisis stabilization unit, we get 5150, individuals from the jail sent to us. So some of them are stable, some of them are not so stable. It depends, but it just depends on, how well they are doing their training, how well they're doing the evaluation, and how well their training was.
I just wonder if maybe APA can kind of operationalize this. We have so many great minds and so many great policies, and some not so great. So maybe it may be a future direction to take the organization in. Thank you.
Thank you. Next question.
Hi, first of all, I wanted to thank so much the family for your bravery, because I've actually been involved in helping after shootings, not so much officer-involved shootings, and the very frequent thing that can happen because it's so painful is to become silent and not, it's maybe easier to be silent. So thank you so much for your bravery in making things better and saving other lives. That's so important. In answer to the question about, have you seen successful police de-escalations? Yes, I have. It can be done. And I wanted to thank Dr. Cho? Yeah, for pointing out that it's not just a matter of don't do this. You can say do this. There's so many things that can be done that are helpful. And finally, I just want to thank everybody so much for such an important presentation.
Thank you. I want to do the obligatory thank you for coming, because I chose to come to something like this rather than learning about medications, because this will stay with me more than anything else. When it comes to this, it's kind of an us and them. There's the police department, then there's us. And it needs to, I believe it needs to come to, can we go to those officers that shot and talk to them? What they pretty much become now is stone. Like, you're against me, you don't understand, I'm just gonna harden my heart, I have no empathy. Even looking in the woman who was interviewing and she's saying her part, she sounds like a machine, but she's a human being. If we could say, could you please drop that facade and understand that was somebody's son. If that was your son, you would probably be just like me. But police officers, I mean, I have a private practice and I've seen one, and the guy was like, please keep this off the record, I'll lose my gun, I'll lose my career if I come and you report that I have depression. But they should come to us so they can process that, because those men now are gonna be machines and very angry, and they're gonna drink themselves into comas every night, and it's not gonna get better, and this will happen again and again, and that's what we're seeing. But if they could just open the door and be like, we're not trying to attack you, we're just trying to meet in the middle, because we're all human beings. So I just wonder if there's any way we can get into the police department and teach them just okay, we get it, we understand you were scared, but how can we do it differently so when the next son or daughter is over there and they're having a psychotic episode or a reaction to medicine, how can we do it differently so that their deaths are not in vain? I know it's probably not an answer. I just wanted to go from that
Sounds
point.
like a great idea.
Yeah. Thank you.
Thank you.
Hi, thank you so much for your talk. I really appreciate an open space to appreciate the lives that I've lost and also have an open discussion. My question is for the clinicians, but also for Dr. Yang. We can have these discussions now where we're talking about changes to the system, but those can take a lot of time. I'm curious what advice you would have, especially for us young professionals and trainees in the room. How should we advise families who are unsure and unsafe around the police, and how should we advise them if in a rare case they do express some sort of violent tendencies to the family? How can we advise them to where to go from there when the police might not be the safest option?
You're exactly right. But I'm just mere parent of a mentally ill person. Cannot give you the right answer for that. But I believe there are many steps of changes can be made with lots of efforts. But I believe the true problem of this in the United States police killing civilians is they have this psychology. The police psychology is all messed up. They are okay to kill. Maybe they've been playing the shooting games for so long, or they don't get punished at all. So unless we have some kind of a movement, nationwide movement of mental health, because their mental health is not good either. They are all messed up. How can you just go and kill and it's okay? You're not punished, and it's okay. And a lot of them are praised and become an internal hero. So when in these 9 police officers who were involved in my son's death, a whole bunch of different people, like 30-year veterans to like a rookie. And then this rookie is learning that this is okay to kill. Maybe they will have learned some psychotic problem, but they know they will be okay killing, and they know killing a civilian will make himself or herself a hero, because that's what's going on. So I really asked the psychiatrist talk about this problem openly more often in journals, in magazines, in public places, so that people know that this has to be changed. Nowadays, when I go, probably a lot of people, you go somewhere and you meet police officers, you are supposed to feel, oh, this is more safe. It's now safer, more safe than the police was not around. You have to feel that, actually. Police is here, so it's a safer place now. But now what we feel is, police showed up, so it's more dangerous, right? When police stops you in the highway, you have to put your hands on the steering wheels, and you have to be very careful. You have to smile. You have to follow the directions. But in UK or in Korea, you don't have to do that because you're safer with them. So this whole American mentality, psychology on this matter is all messed up. This has to change. Policemen come to your home and then they are the now, how do I say? They are the controllers. No, they are not. If they have to enforce something, that's their job, but they have to be mannerly, right? They have to care other people also, like all of us. So I really think that if you can somehow get involved in a movement, that the police should be not a killers, but caregivers. That kind of thing would work much better. I hope. Okay. Yeah, thank you so much.
Thank you.
Thank you so much.
One more question?
Yes, I had a comment. First of all, I'm really sorry about what happened to your son. And to me, it's horrifying. I have a daughter who has bipolar disorder, and she called 911. The police officer showed up at my house. And I told them, no, you're not going to my house. I want the SMART team. So they brought the SMART team. Meanwhile, the police officers asking me if I've tried to evict my daughter from my house so they can have a reason to take her. And then the SMART team came. She was upstairs in her room, and he didn't even go anywhere near the door. And he said, oh, we just want to talk. I'm not coming out. And they walk away and say, there's nothing we can do. I mean, I asked them, I was trying to get them to bring her to the hospital, but they wouldn't do it. And the only way she got in the hospital is she left the house. And then when she was wandering around on the street, then they picked her up. So I know this doesn't compare to your situation, but I think it illustrates a real disconnect. Because the police officer talked to me, I was dumbfounded as to why he even asked me that question. And then I was appalled at the SMART team's response. I mean, they didn't say, oh, I'm gonna sit here until you open the door, when you're ready. They were just like, oh, we can't talk to her, we can't take her. That's not helpful either. I mean, she didn't die, but I didn't get her taken to the hospital. If she hadn't left the house, she would still be in her room. They were absolutely no help. So I have lost faith in the SMART teams and the police officers in terms of, are they going to do the right thing? It wasn't dangerous, but it was incompetent. And I guess I consider myself fortunate that they were incompetent, not dangerous. But I was just appalled.
Thank you.
Chula Vista.
I joined late in his presentation, just wanted to thank everyone, but maybe we can end on the note of hope. I'm a psychiatrist. I'm a consultation liaison psychiatrist from Houston, Texas. My husband is a police officer who is striving every night before he goes to work we say a prayer before he leaves. He follows. We are the members of the Church of Jesus Christ of Latter-day Saints. We follow the principles that he's trying to serve the community. The danger is becoming those that a lot of times I think there are two sides of a coin. The police officers on the streets are fearful for their lives because their lives are in danger. So I think the communities are at this big standoff where we have to build these bridges of hope, because hope is always there. And I can attest for my husband, we've been married for 26 years. We have 4 children. He strives to serve our community. And I feel safer because he is on the streets. And so I just wanted to end with a message of hope that we can all work together. Thank you.
Yeah, thank you for you and your husband's service, and I think that goes back to the warrior versus the guardian policing. I think there has to be a balanced approach, flexible approach. Sometimes you have to be, more of a warrior. Sometimes you have to be more of a guardian, and is it possible to have both? But you don't have to be a warrior when you're dealing with a 7-year-old autistic, kid who's acting out. There's no need to handcuff a child or someone having a mental illness. There's no need to, use overly lethal weapons. But I feel your pain, and thank you for sharing.
I got the signal that it's time to wrap up the meeting, so if you have any further questions, we'll answer them outside.
I will,
Dr. Cho, it's
just last, coming here, sharing very traumatic experience. there's one way I cope with my traumatic experience is singing. So do you want to hear my singing? Okay. You can leave.